Hi everyone, it's Elle. Today we're going to be talking about a few different ways that you can help prevent PP-PTSD. And for those of you who don't know, that's postpartum post-traumatic stress disorder. When we treat or prevent PTSD, and we're also preventing some other things that may go along with it, such as depression and anxiety. So, by targeting the prevention or by targeting PTSD and preventing it from happening, we're also targeting some other mental health conditions. So, just keep that in mind. So, it can be a 2-for-1, a 3-for-1, all sorts of things. All of this stuff is good for you, every single one of these things, no matter what your risk factors are. Okay, so let's go ahead and start. The first thing is good mental health after pregnancy or before pregnancy, excuse me. If you have depression, if you have anxiety, if you have PTSD already, if you have traumas that have not been resolved through therapy and perhaps even pharmaceuticals, meaning prescription drugs, then now, if you're not pregnant, now is the time to get that addressed because it's much better to have your mental health good before you get pregnant and have baby than after. Because afterwards, you're going to have a lot of other tasks and important things to do. You will be busy. So make sure you start your pregnancy with good mental health. Um, some things to think about, specifically traumas. A lot of people think of traumas as like a near death experience, like maybe they were a soldier in combat. And certainly those are traumas. But other traumas occur too that are a lot more seemingly normal. If you were abused by parents, if you have been sexually mistreated at any point in your life, if you have been in a car accident where you feared for your life or the life of someone else, if you have given birth before and that birth was traumatic to you. There's so many different things that trauma can come from. And trauma can come from just about any type of situation if you're fearing for the safety of yourself or the safety of another. So make sure that you're addressing any traumas in your past and tell whoever you're going to go see, so a counselor. Tell them, say, "Hey, I want to get pregnant. I want to have a child, but I want to make sure I have good mental health before I do that." And they will help you out. They are professionals, they know what they're doing, so you'll be in good hands. And I highly suggest this for any woman who's thinking about having a baby. Some other things that you can do before you become pregnant and during your pregnancy: stress reduction techniques. So, meditating. There's so many good ways to meditate. I mean, YouTube has you covered. There are also apps out there that are wonderful. So, just consider meditation. This is something that is research backed. It's not just woo woo. We know that it actually helps. So, give it a shot. Meditation, deep breathing exercises. So breathing in for a count of, say, 4, and then breathing out. So breathing in through your nose, count of 4, breathing out through your mouth, so count of 5, 6, 7, 8, 9, 10, or something similar. The most important thing is you're breathing out longer than you're breathing in. And when you breathe in through your nose. When you breathe out through your mouth. Patients always are like, okay, yeah, like this is going to help. But what I love to do is put a blood pressure cuff on them before they do the breathing exercise. And then again, about 10 minutes later, after they're done with the breathing exercise, and they can see an immediate drop. And so that allows them to see a real life example, real life proof of the benefit that they're getting from this breathing. So if you have a blood pressure cuff at home and you want to test it, go ahead and do it. You'll be surprised at how much that breathing can help regulate your body and your blood pressure. Another thing is yoga. Of course, with yoga, it is exercise. So you need to make sure you're cleared by your physician to do this. Not all women are going to be able to do yoga during their pregnancy. And this is really something you're going to have to discuss with your obstetric care provider. But for those of you who are, especially before you become pregnant, yoga is one of those treatments or approaches, if you will, that have been shown to be very effective in stress reduction and the prevention of postpartum PTSD signs and symptoms. Okay, so those are all some wonderful options, especially before you become pregnant. Again, make sure you have depression, anxiety, PTSD treated, go into a counselor, tell them that you want to get in tip-top mental health shape so you can be a great mom, address any of those traumas during therapy. And then also look for stress reduction. Again, that's meditation, breathing, yoga, any of those things. Okay, something that people don't realize is how important sleep is. While you're pregnant, it can be hard to sleep. It can be uncomfortable. In the beginning of your pregnancy, you may have breast tenderness that makes it difficult to sleep if you enjoy sleeping on your side or your stomach. And throughout your early pregnancy, you may have nausea that makes it hard for you to be in certain positions, right? And then towards the end of your pregnancy, you may have really bad acid reflux, to the point where you have to sleep in some kind of inclined environment, maybe even a lazy boy, right? Because you throw up in the night if you're lying down. And then also there's the aches and pains of a big belly, trying to get comfortable when your belly is in the way. All of those things make it hard to sleep. But it's so important you protect your sleep. Protect your sleep, protect your sleep, protect your sleep. And there's actually been research that has shown that if you don't get enough sleep before you go into labor, before you have your baby, you have a worse birthing experience. You're more likely to have interventions. It's going to be more traumatic for you. So make sure you're getting your sleep, especially as you get close to delivering your baby. So important. And that's something that occupational therapists can help you with. And that's something that we work on with other patients and other clients. We call it sleep hygiene, but it's those methods that help you get ready to go to sleep and then the actual sleep and rest, right? That's within all of our occupational framework is rest and sleep. So they can help you if you're having any issues there. Another thing, tell your physician or your nurse practitioner, whoever or your nurse, certified nurse midwife, whoever you're seeing, let them know that when you have the baby, you want the baby to go directly on your naked belly or your naked chest, wherever your mama's naked skin. So naked baby skin to naked mama skin. We know that skin to skin contact has been shown to prevent postpartum PTSD signs and symptoms. And it's kind of magic, right? They actually call the hour to 2 hours after giving birth the sacred hour, the magical hour, or the golden hour. All three have been used. And what that is during that time period, your baby will go through about 9 developmental innate stages. So they just know to do it, they'll go through it, and we'll go over that another time. But if mom keeps baby on belly or skin to skin that whole time, baby has benefits. So their breathing pattern, their heart rate, all of that starts to regulate to match the parents. But then the parents' psychological stabilization also takes place. So we know that through research, skin to skin contact, especially within that hour or two after giving birth, can help prevent the development of PTSD down the road. So it's good for your mental health. Do it, make it a priority. Let your obstetrics care provider know you want to do that. Let them know beforehand, and then they can put it in like a written birth plan. And also, when you get to the hospital, make sure your labor and delivery nurse knows that you want that skin to skin contact. And when your obstetrics provider comes in to deliver your baby, remind them that you want that skin to skin contact. And it's so protective for both of you. So I would highly, highly recommend that 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 approach, and it doesn't need to even be an intervention. I think of it as an intervention because I'm coming from it as a healthcare professional. But for you as mom, you can just protect that mother infant bond. So, highly recommend that. And something else that I highly recommend is screening for traumatic birth. There are 4 simple questions that can be asked that help you to know if you had a traumatic birth. And so the first question deals with did you fear for the life, for your life or the life of your infant, right? And then the second one is, did you fear for the safety, like the serious injury of you or your infant? And there's one question that asks if your labor was hard and upsetting. And the other one escapes me, but I'll add it in the comments. So make sure that you check on the description rather than comments, the description, and I'll put those in there. So, that's something that ideally an occupational therapist is doing, but, in a pinch, you can kind of go through that inventory on your own. But I would highly recommend that you have a healthcare provider walk you through that and where to go from there. So if you get any of those answers positive, a yes to any of those questions, then you have risk factors for developing postpartum PTSD because you screened positive for traumatic birth experience. All right, so screening. We need to get to universal screening when we're screening all moms for traumatic birth experience. So easy. Four question, four question assessment has been shown to be reliable and valid. So let's use it. Let's just make sure that we are catching all of the moms that have those symptoms, those risk factors for developing those signs and symptoms of postpartum PTSD. All right, if you screen positive for traumatic birth, do a visuospatial cognitive activity within 6 hours of giving birth. So, this is again something that ideally an occupational therapist is doing because they are experts in function. This is something that they're going to be a lot better versed in, and they can look out for risks. Like for example, the visuospatial cognitive activity. So that could be Tetris, it could be Candy Crush. It needs to occur within 6 hours of giving birth. And you also need to make sure the sound is off of the device you're playing on. And this is so important. Sound off. Make sure the sound is off. And you need to make sure it's for 15 whole minutes. Another thing is don't sleep before you do this. And the reason why I say that is because this intervention is attempting to prevent what we call the consolidation of short-term memories to long-term memories. So we don't want those traumatic short-term memories to turn into traumatic long-term memories. And when does that consolidation happen? During sleep, right? That's when things are really cemented. So make sure you're doing those interventions before sleep. And again, really, I would highly suggest an occupational therapy oversee this because there's a lot of small details and that somebody who is well versed in this could help with, whereas someone else might miss. So that's something. Okay. So as healthcare providers, let's do that. The next thing, after baby is born, if you had traumatic birth experience, expressive writing, so journaling in depth about the birth, the labor, and the delivery, all of those things. That has been shown to be preventative in developing the signs and symptoms of PTSD. So write, journal about what happened. It's great for your child's baby book, for your memories. I would suggest sitting down, piece of paper, pen, pencil, writing by hand, because there is a difference between typing and writing. And we've seen that. For example, when you're studying for a test and you're writing notes, it is much more beneficial to write by hand than to type. And so it's because you use different parts of your brain while you're doing this. So make sure that you are journaling. But the most important thing, just journal. Journal, journal, journal. I would suggest by hand, but journal in general. Okay, so the next thing, relaxation techniques. Remember, PTSD stands for post-traumatic stress disorder, right? So if we can prevent stress, we're also preventing PTSD. And some ways that you can prevent stress are through relaxation techniques, including muscle relaxation, guided imagery, yoga if you're medically cleared by your healthcare provider. But that's the important thing, right? Don't please, the day that you have your baby, please don't start doing yoga. And then, when you have something wrong, say, no, 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 I'm supposed to do it to prevent stress. No, don't do that. Only do yoga if you have been cleared to do it. Okay, so again, for relaxation techniques, we have muscle relaxation, guided imagery, yoga, and then deep breathing. So we talked about that at the beginning too. All of these relaxation techniques are super helpful before you become pregnant, during pregnancy, and after you give birth. But we know, especially after giving birth, that these approaches have been shown to be beneficial in preventing the development of PTSD signs and symptoms. So, but what the caveat with that is it needs to be regular. It can't be like a one and done, like that Tetris or Candy Crush intervention. This is something that has to be continual. So ideally every day. Less ideally, let's say 5 times a week. But you want to make sure that you're doing each of these things regularly. And so muscle relaxation, again, YouTube is your friend, but there are also many apps that are absolutely wonderful that can help you with muscle relaxation. And you can just Google, muscle relaxation apps, and you'll find some good options. Just read through the comments and find what works best for you in the description. Guided imagery, again, YouTube is your friend. There's so much free guided imagery, but again, apps. And most apps that have muscle relaxation also have that guided imagery. And really, both of these are part of meditation. So meditation is going to be beneficial. And then again, yoga. There are tons of places that you can go, yoga studios. There are videos available. I know the streaming services have some yoga programs, and you can look online. There's so many different ways that you can get inspired to do yoga. And I know there's even yoga for new moms. With COVID restrictions, it might not be available right now, but that's something I would look into your local rec center. And then the deep breathing. I cannot oversell deep breathing. Deep breathing is your best friend. If you feel stress or panic starting to bubble up, start that deep breathing right away. And then you can go into one of these other things, get yourself into a safe area, make sure your baby or your other children are safe. And then, you're having your breathing, go into muscle relaxation, guided imagery, and if you can, yoga. So I hope these points were useful for you. And just a quick recap, make sure you have good mental health before becoming pregnant. During your pregnancy, make sure you get plenty of sleep. Um, Make sure your physician and your nursing staff knows that you want immediate skin to skin contact with your infant and for quite a while, for a long time. Screen for traumatic birth, healthcare providers. Let's do that. And again, check the description below, or to the side, whichever way you have it showing up. But I'm going to be putting those 4 questions in there. The other thing, make sure that if you have a traumatic birth, you're doing that visuospatial cognitive activity, which is Candy Crush Tetris, sound off 15 minutes within 6 hours of giving birth. Expressive writing, journal about the birthing experience. That's been shown to be beneficial. And then relaxation techniques after the baby is born. All of those things have been shown to help prevent the signs and symptoms of PTSD. So give them a try. They can also act to help prevent postpartum depression and postpartum anxiety, as they are all related. All right, you guys, until next time, bye.